this is James, and today we're going to start talking about Morton's neuroma, what the causes are and how to treat it and how to diagnose it. So James is going to just tell us a little bit more about what it actually is.
Yeah, so between the web spaces of all your toes, you've got a nerve that passes through called your interdigital nerves. They help innervate your toes in terms of giving you sensation, strength and power. If these get compressed, pinched or overloaded, they can become inflamed and they can give you symptoms such as numbness, pins and needles, or pain in the ball of the foot. Sometimes people describe it as having a pebble in their shoe. It's not to be confused with metatarsalgia, which is pain on the bones or the metatarsal heads of the toes. It's more about pain within the web space itself. John's going to talk a little bit about how we get it and what we do to diagnose it.
So a lot of what we would see in clinic when patients are coming in with this sort of symptom is that there will be a few different factors that will lead to it. Often it will be that there's some sort of overload or increase in activity that starts to increase that pressure going through that forefoot and leads to that irritation developing at that point. A very common one is where we have ill-fitting footwear, where it's a little bit too tight in that forefoot or in that toe box, and that compresses the toes together and starts to irritate that nerve. Patients who have a flatter foot, again, are a little bit more risk of this just because of the loading patterns that go through the foot when they are walking or running or whatever it may be, leads to that irritation coming around there. From a diagnostic perspective, what we'll be looking at is we will look at a clinical perspective. We're looking at site of pain, so it would need to be within those those joints in the foot. You're looking at symptoms of kind of like numbness or sometimes a little bit of tingling or pain in between the toe joints. You'd also have pain when we compress the toes together, which is called a Muller's click, so that would be looking at provoking those symptoms. It can also be diagnosed with some imaging as well, which you can do through ultrasound scanning. Also you can use MRIs to get an accurate diagnosis, and from there then you're looking at kind of like how we would treat it. So James is going to chat a little bit more about how we would treat this issue.
Yeah, so at the first stage is when somebody comes in the clinic, it's an inflammatory condition, so we're immediately thinking about how we can offload it. First protocol may be reducing your step count, trying to introduce cushioned footwear. If somebody has poor foot control, we might think about a stability shoe. That can be a running shoe, even if it's for walking. A lot of the technology goes into running shoes and they can be multifunctional, so we can use them for all sorts of activities. In terms of how we would treat it, we would look at any muscular imbalances, look at if we can improve your foot stability. Normally we'll do a biomechanical foot assessment. That may include a foot pressure plate where we can look at where you put pressure through your foot, a gait scan analysis where we would look at how you move, if you're putting excess pressure through your second to fifth metatarsals as you walk or run. In that instance, we might consider an insole. Normally with an insole, we look at a metatarsal pad. This is something that you can buy on its own and put it inside your shoe, and all that does is it helps raise your metatarsal heads. It gaps the space between the metatarsals, that web space where the neuroma sits, and takes the pressure off the nerve. Normally that's sufficient to calm it down. Once it's calmed down, we start some strengthening exercises to correct the imbalances that cause the issue. In stubborn cases, we might look at an injection into the nerve. This is normally a corticosteroid injection, should be done ultrasound guided. That helps reduce the size of the nerve, and then we will begin the rehabilitation process again. In stubborn cases where an injection fails, we might look at an injection plus a period of time in a boot before beginning rehab, and if that's unsuccessful, we might look at removing the nerve via surgery. This has a mixed outcome. Sometimes people can get a Morton's neuroma stump afterwards, where they get a little growth on the nerve, and that can cause a lot of complications, and sometimes the symptoms are worse afterwards. So surgery is generally the last port of call for us. We would look at offloading, anti-inflammatories, insoles, correct footwear, strengthening and mobility, and really that helps most cases. And then if we're really struggling, we'd look towards an injection followed by surgery.
So we've covered most of the treatment and management of a Morton's neuroma. So if you have any questions, just drop them into the comments and we can hopefully give you a little bit of an answer if we haven't covered it already. But yeah, also we have a few exercise videos which you can click on the links below and try them out if you are suffering from this condition. And as mentioned, any other questions, just let us know.